everybody. In this lesson, we're just going to really quickly go over the diagnosis conjunctivitis, or what it's more commonly known as pink eye. So conjunctivitis is when the conjunctiva is inflamed. So you've got inflammation there. And just as a quick refresher, the conjunctiva is the clear tissue that covers the inner surface of the eyelid, as well as the sclera, which is just the white part of the eye. And so you can see in this photo here how the sclera is very pink and very inflamed. And that's where we get the name pink eye. And it's really important to know conjunctivitis is very, very, very contagious. Most of the time it's caused by a virus, but you can see cases that are caused by bacteria. And then you can also get some allergic conjunctivitis as well. One thing I want to highlight here is that it's very, very important to be on the lookout for conjunctivitis in our newborn patients. And this is because they can be exposed to things like gonorrhea and herpes and chlamydia during delivery. So these patients are going to need really prompt treatment with antibiotics. We're not going to wait and see if it's viral and see if it's going to go away by itself. They need antibiotics straight away. So on your assessment, generally someone who has conjunctivitis, they're going to have a pink eye or a red eye, and you can see again here in the photo, they may have burning and itching, and they may also be having increased tears. So those are kind of just general symptoms that you would expect to see in any case of conjunctivitis, but there are a few specifics that can help us make the distinction between those different causes that we talked about. So if a child has bacterial conjunctivitis, they're probably going to have that purulent drainage. So they're going to have pus coming from their eyes. And a lot of times these kids just wake up and their eyes are completely crusted over. And that's associated with maybe bacterial. And so intense itching is associated with allergic conjunctivitis. And then if you have watery discharge versus that pussy discharge that we talked about with bacterial, that's often associated with a viral conjunctivitis. And then another thing to note is if only one eye is affected, it could be that there's a foreign body in that eye causing that problem. Treatment is pretty straightforward. So the first thing we want to do is teach families how to keep that eye clean. And we want them to do this properly. That's going to help with comfort, and it's also going to help prevent spreading the infection. So what they need to do is sweep the secretions down and out and away from the eye to make sure that it's not getting in the other eye. And then if the cause is bacterial, they're going to be needing to apply those antibiotic ointments or drops to their eye. And these should be applied after they've cleaned the eye properly. It's important to note that the ointment can cause the eyes to become really, really blurry, so their vision is blurred. So they're usually only applied right before bedtime. And then remember, I said this is very, very contagious, so it's very important to teach families how to prevent the spread of this. So it's spread via contact. So hand hygiene is probably the most important thing. And families need to also avoid sharing linens. And then the child actually has to stay away from public environments like school until they've been on those antibiotics for at least 24 hours. Okay, so based on what we just talked about for conjunctivitis, your priority nursing concepts are going to be infection control and comfort. So number one, we're making sure that infection doesn't spread throughout the entire family or school. And then we're also making sure they know how to keep that eye clean for their comfort. All right, let's go over your key points for this lesson. So conjunctivitis is when you have inflammation of the conjunctiva, and it's often called pink eye because you're going to get that really characteristic pink or red look to the eye. Remember, it's super contagious, so our key nursing points are going to be all about preventing spreading of it, so we want good hand hygiene and keeping the eye clean properly. If we think it's bacterial, they're going to need to have antibiotics, but viral and allergic conjunctivitis, our treatment really is going to be just supportive until it resolves on its own. That's it for our lesson on conjunctivitis in our pediatric patients. Like I said, it's very straightforward, but do make sure you check out all the resources that we have attached here. Now go out and be your very best self today, and happy nursing.